Hi, my name is Brittany Hunley. Thank you for joining me for this video, Understanding Medical Sexual Issues, when the body says, not now. This is a sex-positive guide to medical conditions that affect sexual health and what you can do about them. Welcome. Many people experience sexual challenges due to medical or hormonal issues. You're not broken, and you're not alone if you are one of them. There are tools and treatments and healing paths ahead of you. And if you're someone who's here learning more because someone you care about struggles with these issues, welcome. And thank you for being an ally and a supportive partner. What are sexual medical issues? Well, medical sexual issues are challenges caused by physical, hormonal, or neurological conditions that impact sex. They're very common, but often not spoken about, which breeds a lot of shame and not a lot of healing for folks. So, great job showing up today, taking a step against that. There is a path to healing that can include medical, therapeutic, and lifestyle based supports. There are common conditions and care approaches to each one. Let's start with vulva, ovary, and whole body. So, vaginismus. This is one of the conditions that women experience that is maybe the most well known or well discussed. Most of us have maybe heard the term vaginismus. What it is, it's an involuntary contraction of the pelvic muscles that makes penetration painful and sometimes even impossible. The treatment is often pelvic floor physical therapy, which includes biofeedback and desensitization, dilator therapy at your own pace, and sex therapy, especially trauma informed sex therapy. Anxiety reduction practices like breathwork and mindfulness, and sometimes even Botox injections for really severe cases. Dyspareunia, which is a very hard word to say, and I may not have even just said it correctly then, is a very difficult word for painful sex. The cause is typically hormonal dryness, vulvodynia, endometriosis, and sometimes trauma. The supports that are available are vaginal moisturizers like Replens and lubricants. Silicone-based often are preferred. Local vaginal estrogen, which has to be prescribed, pelvic floor physical therapy, sex therapy, especially with a trauma-informed sex therapist, to help with partner communication tools, and mindfulness-based pain management. Endometriosis. Endometriosis is when intrametrial tissue growing outside the uterus causes pain and inflammation. And I'm laughing while I'm mispronouncing these words, but it's exceptionally painful and often underdiagnosed and undertreated condition that women experience. The treatments are laparoscopic surgery, hormonal birth control, anti-inflammatory diets and supplements, pelvic floor physical therapy, uh, counseling for chronic pain management, and mindfulness practices like gentle yoga and stress reduction. Polycystic ovary syndrome, so PCOS, as it's commonly referred to, is a condition that causes irregular periods, can cause low libido, and insulin resistance. It's usually managed through metformin or hormonal birth control, anti-androgens, low glycemic nutrition and movement, and body image and sexual self-esteem work in sex therapy, as well as sex therapy to reframe sexuality beyond reproduction. PMDD, or premenstrual dysphoric disorder, is a mental and emotional intensity pre-period. It is a mental health diagnosis that is hormonally charged. The treatment is usually an SSRI, sometimes only during the luteal phase or PMS phase, hormonal birth control, light therapy and circadian regulation, light therapy as in light therapy, not gentle therapy, nutrition management and supplements like omega-3s, magnesium, and B6, and therapy for mood regulation. Menopause can cause vaginal dryness, burning, and pain with sex. Most of us have heard the term menopause, and it's usually the stage of life for females that follows our years of menstruation, perimenopause, menopause. The treatments for this are local vaginal estrogen, hyaluronic acid-based moisturizers for the vagina, silicone lube for friction reduction, and education around pleasure and redefining intimacy. Let's move on to the gentlemen, those with penises. So there's penis testosterone dependent conditions like erectile dysfunction, which might be the most well known of all of these, the most studied, and the most treated of all of these disorders and sexual medical issues. Erectile dysfunction is a cardiovascular disease. It can be caused by, cardiovascular disease, diabetes, stress, and sometimes even porn habits. Um, Most men who seek only medication treatment for erectile dysfunction do not see results because it can be such a holistic, systemic issue. A lot of times they are prescribed medications such as Viagra or Cialis, which we've all heard lots about. Testosterone testing might be a good course of action, and with possible hormone replacement therapy. Therapy for performance anxiety, sex therapy for performance anxiety, and lifestyle changes like exercise, sleep, reduction of alcohol, and mindfulness intimacy training. Delayed or inhibited ejaculation. Just a reminder to the viewers out there, English is my second language. I know I have no accent, but bear with me. So the contributors to this issue of delayed or inhibited ejaculation can be SSRI use, anxiety, shame, or low arousal. So supports might be adjusting medications with a prescriber, slowing down the sexual pace and focusing on sensation, fantasy exploration and reframing of orgasm goals with a sex therapist, and sex therapy or couples therapy for pressure-free connection. Peyronie's disease. Peyronie's disease is a painful curvature of the penis. It is oftentimes treated with oral or injected medications, vacuum devices and penile traction therapy, surgery in severe cases, and therapy to address any shame or self-image that might arise. Low testosterone. The symptoms are low libido, fatigue, and mood changes. The treatment is often testosterone replacement therapy, gels, injection, or pellets, strength training, and sleep hygiene, and therapy around aging, identity, and sex drive. Let's talk about neurodivergence and chronic illness. You may not think that those two go together, but there's often a lot of overlap. Conditions such as POTS, lupus, muscular dystrophy, cancer, fibromyalgia, diabetes, ADHD, and autism are all going to be discussed in the following. The challenges that overlap these conditions are fatigue, overstimulation, executive dysfunction, fear of flare-ups. Here are some supports. Energy pacing and planning, sensory-friendly intimacy strategies, communication tools for disclosing needs and limits, occupational therapy and sex therapy, and creative adaptation, side-by-side touch, eye contact, non-sexual affection, and mutual masturbation. Let's talk about the emotional toll and shame narratives that can derive from all of the things that we just discussed. So, a lot of folks feel like their body is betraying them. And I'm here to let you know it's not. Your body is not betraying you. It's trying to cope. So reframing is really important. And I also want to validate that it's okay to grieve a change in your body, how it works. That's really valid. Self-compassion practices and sex-positive language really matter here when we have a medical condition that is also bringing up emotional shame. Redefining sex and intimacy. Sometimes the best course of action is to focus on connection, sensuality, and consent, not just performance, while we're figuring out how to work on, fix, or solve, manage our medical issues. Expanding the definition of sex to include whatever fosters closeness would be highly recommended. And a great mantra to live by is pleasure is your birthright, even when the rules change. If you want to learn more about any of these specific issues, stay tuned because there will be more videos with more in depth for each one. Thank you.